Hey everybody, this is Dr. Michael Dent here with HealthLynked, and just want to do a little update on where we are at the company and what's been going on. A lot of activity here at HealthLynked, and as you can see, I'm working from home today, and just want to first off giving an update on the global statistics for COVID-19. If everybody's looked at their app, you'll see that globally, um, you see that we're at 2,196,208 cases, confirmed cases. We have 532,956 recovered individuals from the virus, and bad news is there's 145,212 deaths reported globally. So here in the U.S., we have 700,365 cases, 34,986 deaths. The majority of those, of course, have been in New York. You probably heard about that on the news. And then the U.S. has now surpassed Italy. Italy has 22,170 deaths. So not a good sign for us here in the U.S., but probably all that's our reporting and us testing people here. We've been more effective at doing that, which has been good. But unfortunately, in the statistics, it reflects more deaths and more cases. So what I want to talk about today is our global healthcare initiative with HealthLink, what the company's really about. As most people know that are probably watching this, we have had out in the App Store the COVID-19 application. We're one of the first companies to come out and do that, where we really allow patients to come in and report their symptoms. We locate that on the map. It's not specific to their location. It can be in a region, in a city, or a specific area. And that's been very helpful to understand where the virus is going, where it's been spreading, and what the risk that we all have with that. So I encourage everybody out there that has downloaded the app, there's been over 2 million plus downloads, to go ahead and self-report. That'll be very important. And continue to do that and update your status. So if you've noticed as well, we're one of the only companies that allows our statistics reported by county. So if you look at, let's say, Johns Hopkins or another app, you'll see that they report just by a state. So it's important that by county you can know what's happening in your actual region. We have an update coming out today on the application. There'll be another one probably later early next week. That's going to allow you to, as you zoom down, have those dots kind of disappear or actually appear. So you won't see so many. It's a little bit overwhelming right now. We know that with all the reported cases. So be on the lookout for that update. I think it'll be very helpful to how the app presents itself. The second thing to talk about is, let's see, the chat area. So we've been having a lot of activity in the chat. We want to encourage people to go there and talk. It's a global community. We added in some features where people could know what region they're from. We thought it was important. So you can meet people all around the world and find out what's really happening in their area and hear from people directly. So the news is interesting, but sometimes talking to people locally gives you a better idea what's really going on. So shifting focus for a little bit, talk about what HealthLynked is as the core company. We connect patients, doctors, and healthcare data. That's our focus, and we focus on our patient members. So what we do, to be really clear, is that we don't work with pharmaceutical companies, we don't work with hospitals, we don't work with insurance companies. We're out here for the benefit of our patients. Your information is secure, and we don't share with any of those people. So we're not looking to provide any information on our patient members to anybody else. It doesn't go anywhere. We don't market to people or sell that information off. So just be aware of that. And we are very secure in how we keep that information private. So you should all take a look at our primary application. If you go into the Apple Store or the Android Store, you'll see HealthLynked there as an app. You can download it or go to our website, HealthLynked.com, and you can create a free profile for yourself. You can connect to your physician. Here in the U.S., we have over 880,000 healthcare providers. So your doctor will be there, and if it's not, just send us a message and we'll make sure the doctor's added to our directory. You can upload your healthcare records. You can connect to your family. And that's going to be really important if somebody gets sick in your family or need information. So we encourage everybody to go do that here in the next few weeks. We want that information to be available, and that's for free as well. So no additional cost to do that. We are working on adding telemedicine to the platform. That's actually already been kind of added in the background. We haven't released it yet, so we're hoping to do that here in the next few weeks. The other technology, if you look at our main company, we have a check-in technology through mobile device applications to the phone. So we have physicians that have that installed in their location. So we want to encourage you guys to let people know about that, because it allows you to check in for your appointment in your car in the waiting area, in the parking lot. And you have to go into the waiting room where the people might be sick, or touch the pencil, or touch some other type of check-in device. So it's very, very timely, and it's very appropriate to keep people healthy. So take a look at that. Talk to your doctor if you see one. Let them know about the company so we can get those devices out to them, so we can protect you and your family from exposure to COVID-19. Another topic to talk about is we're working on developing some additional stuff for the application with some people out of Stanford University, and we'll be adding additional analytics around the application. We believe that we can add some significant value by letting people know where people have been that have symptoms from COVID-19 or have tested positive, without releasing people's information. So what that would look like would be, you can know if you're going to go to the grocery store, if somebody had been there in the past 6 to 7 hours, the amount of people that had COVID-19, and a risk factor group for where you were. So really hot zones you could avoid, and those hot zones would tick down probably over the course of 24 hours, because we know the virus can only stay outside the body for so long. So we're excited about maybe releasing that here in the next few weeks. We're working on it now. Just give you a heads up, we think that's going to be much more valuable than what Google and Apple are talking about, is actually tracking people, which we think is a violation of their privacy. So I don't think we want to be doing that, and that's not something that HealthLynk thinks is appropriate. Last couple of points, about HealthLynk. We're a global healthcare network now. We're the first global healthcare network, and that's really going to be built by patients, you patients, to kind of come in and put your information into the system, connect to your doctors. You can do that, like I said, very easy to do. And we're working with some other people to kind of really bring about a change in healthcare here in the U.S., and it will be global. So your information will be with you at all times. If you have a heart attack or a stroke or some sort of a car accident, you can know that we'd be there to help out and get information to the appropriate healthcare providers on your behalf. So lastly, I just want to say thank you to everybody that's been out there supporting us, the company that's downloaded the application. Let your friends know about it, have them download it for sure. That's been helpful. And then, look at the main application, HealthLynk, go down and download that. We're still always making updates there as well. You're going to find continuous changes. And thanks for those who have gone into the chat and actually supported us with purchasing avatars. That helps the company. We know that in chat it's kind of fun, but the main purpose of that is to really support our efforts to build this for patients and people around the world. And we haven't, received any money for doing that, because we want to make sure that we keep your information private, and we don't want to have, companies looking to do things that we think are not appropriate with it. So thanks for coming. Thank you guys for tuning in today. And, we'll be doing some more of these. We have some physicians that'll be coming on, giving some talks about different topics. We have some videos on the app as well you can watch. And there's a lot of good stuff happening with the company. So thank you again for your support, everybody. And we'll keep you posted, and have a great day. Oh, and be healthy, be safe.